Warning signs of an imminent or ongoing relapse vary depending on the individual and the substance or behavior. Signs for relapse may include increased cravings or urges, withdrawal symptoms, changes in mood or behavior, returning to old patterns of thinking, social withdrawal or isolation, neglecting self-care or responsibilities, and denying or rationalizing substance use or behavior. Hi, I'm Dr. Tzall, and I'm a licensed psychologist specializing in addictions. Let's review the 10 signs of a relapse and how to help a loved one. Relapse is not sudden. It is a process that plays out in stages and occurs over time. These stages include emotional relapse, mental relapse, and physical relapse. Each stage builds upon the last and increases the likelihood of a full-blown relapse. These stages are different from intentional relapse, where an individual intentionally chooses to use again, and from relapse, where an individual unintentionally relapses after being triggered by different people, places, or events. Intervention is always a possibility, and the sooner one intervenes, the less likely that a relapse will occur. Increasing self-care and using coping strategies and seeking support can be great ways to prevent relapse. Although it is not always apparent, signs of relapse to be aware of include changes in behavior or mood, physical signs of substance use, increased financial issues, and issues with work or social life. It is best to approach the concern in a non-judgmental way, allowing the person to feel like you are a safe place with which they can express themselves. Identifying a relapse is not always clear. An individual may be adept at hiding their substance use or addictive behaviors after years of shame and embarrassment from others. A person may be reluctant to admit that they have started to use again to prevent from feeling like a failure and others cutting them off. The individual may also not be displaying overt signs and symptoms. Here are 10 common signs of a relapse. Stealing or asking to borrow money. Acute financial hardships can be a sign that someone has relapsed. The person may not have enough money to support their habit and will rely on others to help enable their behavior. It is not always the need for money, but the amount, speed at which they need it, and frequency with which they asked that are additional signs that addictive behaviors might have resumed. Defensiveness. When someone feels attacked, they can display defensive behavior. A person may be defensive simply because they do not appreciate being questioned or not trusted. However, defensiveness may also be a sign that they have something to hide and hope that their anger and aggressive outbursts will make the other person feel bad for asking or back away completely. Contacting negative influences. When giving up an addiction, it is best to distance yourself from triggers which can make you want to use again. Triggers fall into categories of person, places, things, and situations. Impulsiveness. As cravings and urges increase, individuals may use poor judgment and act without thinking in order to stop the cravings and anxiety and find peace. They are acting impulsively because they are not taking into account how their behavior can hurt themselves or others. Missing work. Responsibilities such as work can be ignored. It is easy to miss work if someone is experiencing a hangover or oversleeps because they are actively using and are high. They may continue to go to work because of the need for money, but it is likely that its importance and significance as a priority will drop. Changes in physical appearance. A person in a relapse is likely to not take care of themselves. Their main goal may be using the substance or engaging in addictive behavior. Their personal hygiene can suffer, and they can look sleep-deprived and malnourished. These changes can serve as a stark contrast to what they previously looked like. Isolation and withdrawal. A relapse can cause a person to pull away from friends and family. There might be a fear that they would be judged or shamed for using again, or feel that everyone else won't understand. It is difficult to maintain reciprocal relationships if you're in the active stages of addiction. It might likely be best for the person to surround themselves with others who support their habit. 8. Unrealistic expectations that they can moderate their addictive behavior. Moderation can serve as a realistic goal for individuals with addiction issues. However, this is not the case for everyone, and some need an abstinence goal. The issue lies when the person who needs an abstinence goal believes they can manage similarly to if they moderated their addiction. When a person starts to believe that they got it, it might be a sign that a relapse is happening. 9. Changes in mood. Mood swings, including increased irritability, anxiety, or depression, can be a common sign of relapse. Drugs and alcohol impair emotional brain functioning and the ability to properly regulate emotions. Individuals are more likely to be irritable or anxious if they feel that others are checking up on them and instructing them how to live. 10. Disruptions in sleep and appetite. Substances affect a person's ability to regulate their sleep and appetite. Substances affect hunger cues, and they can present with increased or decreased appetite or changes in eating patterns. They may skip meals or forget to eat, or may engage in binge eating or overeating. Sleep can also become a low priority or something they engage in with increased frequency. Drugs and alcohol also prevent a person from having restful sleep, even if they sleep for hours, due to the effects of the substances. Here are some steps you can take to help a loved one after a relapse. Find them a support group. This can provide a safe and supportive environment to share experiences, gain encouragement and accountability, and receive guidance and advice from peers. It is best to research a group that best meets your specifications. Provide a safe place to avoid triggers. Staying away from triggers is one of the easiest ways to avoid relapsing. An environment free from triggers and stressors can reduce risky behaviors and substance use. Identify potential triggers and stressors and create a physical or virtual space that promotes relaxation and calmness. Help to maintain healthy boundaries. Maintaining healthy boundaries can help individuals prioritize their own needs, values, and goals. To create boundaries, people can identify their personal values and goals, communicate assertively with others, and say no to requests or situations that may be harmful. Develop a relapse prevention plan. This plan can help reduce the risk of relapse by providing a structured approach to identifying potential triggers and stressors, developing coping strategies, and taking steps to prevent relapse. A plan is created after identifying triggers and warning signs and identifying supportive people or resources. Intensive outpatient therapy. This type of therapy can act as a structured and supportive environment to address underlying issues and develop coping strategies to manage triggers and stressors. Find a program that meets your needs and goals and where you feel comfortable spending many hours and days. Avoid enabling behaviors. You should avoid this type of behavior, which is characterized by giving your loved one money or covering up for them. This can prevent them from facing the consequences of their actions and hinder their recovery. Draw strict boundaries and set out expectations of how you will and won't help. Be patient. Since recovery is a process, it can take time. Avoid placing undue pressure on them to recover quickly or make them feel like they are doing something wrong. Offer hope and encouragement. Encouragement is a big need to prevent relapse. Hope allows the person to stay positive and give them a sense of a future. Believing in them will have a dramatic effect in increasing their ability to believe in themselves. Here are some final thoughts. Relapse can sometimes seem unexpected, but with the right knowledge of warning signs, you can help support your loved one to maintain their abstinence and support them should lapses and relapses occur. One of the best acts we can provide is offering a safe, non-judgmental space and allowing them to come to us when they're ready.